Hello everyone, I am Dr. Rajita, faculty of NEXTFELLOW. So today's topic is on lungs. So lungs are the principal organs of respiration. So the lungs are basically made of two components, respiratory component and connective tissue component. A respiratory component is made of bronchopulmonary segments where we are going to see the alveoli and bronchioles and bronchial tree. So where the exchange of gases takes place, and the non-respiratory component is made up of connective tissue, which is predominantly contains elastic fibers. So this elastic fibers gives the recoiling capacity to the lungs. So in chronic smokers, this elastic tissue is replaced. So because of reducing elasticity, they will have difficulty in recoiling the lungs during respiration. If we see the color of the lungs, in newborn it is rosy pink color, whereas in adults the lungs appear to be dark slaty grey because of collection of carbon particles in the lungs. Because of pollutants which we inhale contains lot of carbon particles. So these carbon particles gives a dark slaty grey color to the lungs. So the lungs are having the anterior border. If you see the parts of the lung, this is the blue one is the anterior border of the lung, and the green one what you are seeing which forms the inferior border of the lung, and the posterior border is called as the vertebral border of the lung. The upper part is called as the apex of the lung. The anterior surface is called as the costal surface because it is related to the ribs and the costal cartilages. Inferior surface is the base, which is also called as diaphragmatic surface because it is related to the diaphragm of lung. Means right lung is related to right dome of diaphragm and left lung is related to left dome of diaphragm. So the three borders are the anterior border. The blue one is the anterior border, which is a thin border. Here also we can see this is the anterior border, thin border. Inferior border and posterior. So this is the inferior border and the posterior border is this one. This is the posterior border which is partially seen here. So this posterior border is the vertebral border because it is related to the thoracic vertebrae, and posterior border is rounded and anterior border is sharp. So that's how you determine the side of the lung. And the surface what you see medially which is related to the mediastinum is the medial surface. The medial surface is further divided into two surfaces. The anterior part of the medial surface is called as mediastinal surface, where it forms a boundary of mediastinum, and the posterior part is called as the vertebral surface, where it is related to the vertebral body. So those are the two parts of medial surface. So starting with the right lung relations, which are very important. So the mediastinal impressions. So before directly going into the impressions, here we can see the hilum of the right lung, through which the structures go in and come out of the hilum, which forms the root of the lung. And we can see the visceral pleura is reflex around the hilum of the lung and continues beyond the hilum below till the diaphragm as the pulmonary ligament. So this is the pulmonary ligament which is extending beyond the hilum. If we see the structures passing through the hilum of the right lung, epicardial bronchus, then pulmonary artery, hypartial bronchus, and inferior pulmonary vein. So you can remember abbreviation as BABU, B-A-B-U. Instead of U, you can keep V. So on the right side, first is epicardial bronchus. A is for artery, pulmonary artery, and B is for bronchus again, that is hypartial bronchus because it is below the artery, and inferior pulmonary veins. V is for veins. So this is the abbreviation you can remember for hilar structures. Let's see the relations. So above the hilum we can see a groove here through which a vein is passing. So this is the groove for azygous vein. So here it is, the fifth one, azygous vein. So arch of azygous vein is related to the around the hilum, and we can see the azygous vein terminating here where the formation of superior vena cava, where we can see the left brachiocephalic, right brachiocephalic, they join to form superior vena cava, and azygous vein terminates at the formation of superior vena cava. And the structures related here are the one is the azygous, which we know now, and we can see the impression for superior vena cava and impression of inferior vena cava below. And this area is the cardiac area, so which is related to heart, so it is called as cardiac impression. So along with the heart, along with the pericardium of the heart, we have got the right phrenic nerve, because this is the right side, right lung, so right phrenic nerve is related. Then this is the inferior vena cava impression, and we know the impression of superior vena cava as well, and right brachiocephalic vein, so this is the right brachiocephalic vein, and then azygous vein, which we know already, and right brachiocephalic trunk, then right trachea, so here we can see near the apex trachea is related, which bifurcates, and then right vagus along with the trachea, so along with the trachea the nerve along with it is right vagus, and we can also see this muscular organ which is esophagus, which makes a groove called esophageal groove, lies just posterior to the hilum. So this is the anterior part of the right lung, this is the posterior part of the right lung, because anterior border is the thin border and we can see posterior quite rounded border. This whole thing is the posterior border of the lung. So these are the relations. So most important relations are azygous vein and trachea, and it is right vagus, right phrenic. So these are the most important relations on the right side. Mediastinal relations of the left lung from above downwards. In the hilum, instead of Babu, remove the first B. So we have got A, B and V. So A for artery, so pulmonary artery from above downwards, then principal bronchus, then inferior pulmonary vein. So there is a single bronchus, principal bronchus and inferior pulmonary vein. So this is the abbreviation to remember the structures passing through the hilum. And we can see a nice groove here around the hilum, which is formed by the aorta. And just like on the right side we saw the reflection, here also we can see the reflection of visceral pleura, which gets reflected and continues beyond as the pulmonary ligament. So let's see some more mediastinal relations. So I have already told about the arch of aorta, which continues as descending aorta. So there is a groove for aorta along the hilum of the left lung. So right lung is related to azygous vein, arch of azygous. Left lung just above the hilum, it is related to aortic arch, that is the arch of aorta, and which continues as descending thoracic aorta. Apart from that, the cardiac impression, which is present on the left side, pulmonary trunk here, which divides into right and left, pulmonary trunk, arch of aorta, descending thoracic aorta, I have already said. Then left subclavian artery, so this is the groove here for left subclavian artery, left brachiocephalic vein, and also partly esophagus. You can see this muscular organ is the esophagus, and left side left vagus and left phrenic. So these are the relations on the left side. And most important things which you have to remember is the arch of aorta. This is very important, which continues as descending. And on the left side, important relations are pulmonary trunk and left subclavian, left brachiocephalic veins. So as I said earlier, the lung has got respiratory and non-respiratory components. Non-respiratory part is just made up of connective tissue, whereas the respiratory part we can see here, it is again further divided into intrapulmonary conducting part. intrapulmonary bronchial tree, and respiratory units or pulmonary units. So these are the major components. So till here is the bronchial tree, and that is intrapulmonary bronchial tree, and beyond that it is the respiratory unit or pulmonary units where exchange of gases takes place. And bronchial tree is mainly for the conduction of air, where the air flows to and fro from the lungs to external environment and from back into the lungs. So if we start bronchial tree, it starts with the trachea here. So the trachea divides into right and left bronchus. So it divides at the level of thoracic vertebra fourth. It divides at the level of T4, that is at the level of sternal angle or Lewis angle. And the site it divides, it is called as carina. So the carina is very important during bronchoscopy, and it divides into right and left bronchus. And if we see the right bronchus, it is little shorter. It is of 1 inch, whereas the left bronchus is of 2 inches. And right bronchus, it is almost in vertical line with the trachea. So it makes only 25 degrees with the vertical line, whereas the left bronchus, it almost deviates 45 degrees from the line of trachea. So that is the major difference. So the right bronchus, it is shorter and it is wider and it is in line with the trachea. So any infections, the right lung is more prone than the left lung, because the foreign particles can easily enter into the right bronchus. And the left bronchus, it is quite narrow and longer, 2 inches. So the left lung is less prone than the right lung for infections. Right lung again divides into epiartial and hypartial bronchus. Left lung, after entering the lung, it divides into bronchi, further bronchi, lobar bronchi, and left lung. So the left bronchi, you can see the left principal bronchus, it is quite longer, and it divides into the lobar bronchi after entering inside the lung. So the left bronchus, it is just below the arch of aorta. So it is below the arch of aorta and anterior to the esophagus. So that is the relation to the left bronchi. So now we know the right lung is more prone for infections because the right bronchus is vertical in line with the trachea. So aspiration of foreign particles occurs easily to the right side than the left side. Left is more or less horizontal and makes up to 45 degrees of angle. And the site of bifurcation of the trachea is called as carina, C-A-R-I-N-A, carina, where internally it appears to have some median ridge which guides the bronchoscope. So during bronchoscopy, the bronchoscope it can be inserted rightly into right or left lungs based on the guidance of this carina. So the carina is the site of bifurcation of trachea. So if you see the rest of the bronchial tree, the principal bronchus further divides like segmental, terminal, lobar, and finally tertiary bronchi and bronchiole. And when it ends up into a transitional zone called as respiratory bronchiole. So the respiratory bronchiole is the bronchi where it doesn't have the cartilage in its wall. So rest of the bronchial tree contains a hyaline cartilage within its wall. So here the hyaline cartilage is absent, only it contains some smooth muscles around the mucous membrane. So the respiratory bronchiole is considered as the transitional zone, and it continues further to form a respiratory unit or a pulmonary unit which contains the alveolar duct, and alveolar duct continues to form atrium and alveolar sacules and finally alveoli. So the alveoli forms the major part of the lung, which are the sites of gaseous exchange, and which gives the spongy texture to the lungs. So let's talk about the bronchopulmonary segments. The bronchopulmonary segments are the respiratory units of the lungs, so which divides each lobe of the lung. So if you see, the right lung has got 3 lobes, upper, middle and the lower lobes, and whereas the left lung has got upper and the lower lobes. And each lobe, the upper lobe, the names of these bronchopulmonary segments are, see this red one is the apical, and here is the anterior and posterior lobes. Whereas the middle lobe, the orange one is the medial and lateral middle lobes, lateral segments and medial segments. And the lower lobe, that is again has apical, which is the superior apical, then anterior basal, posterior basal, medial basal and lateral basal. So these are the names of bronchopulmonary segments of the right side. Left side bronchopulmonary segments are apical again, then anterior, posterior, similar to the right side. Here also we have got the anterior and posterior. And instead of the middle lobe, the left lung contains the lingula. So this is the lingula. So the lingula has got again medial and lateral segments, and inferior is similar, again inferior lobe is similar to the right lobe, where it has got superior apical and anterior basal, posterior basal, medial basal and lateral basal. So these are the bronchopulmonary segments. So we know the bronchopulmonary segments, they are aerated by its own tertiary bronchi or segmental bronchi. So here is the schematic image which shows the bronchopulmonary segments and how they are having blood supply and drainage, lymphatic drainage. So if you see in each segment, inside each segment, there is a tertiary bronchi or segmental bronchi, tertiary bronchi, and bronchial artery, which is a segmental artery, and also the pulmonary artery. They lie inside the segment. And in the intersegmental planes, these are the veins, where we have got the pulmonary veins which run in the between the segments. And if we see the shape of every bronchopulmonary segment, it is like a wedge shaped. The apex is direct towards the root of the lung. So the pyramidal, the apex is towards the root of the lung. So they drain finally near the hilum. So that is how they are directed. And surgically they are quite important because every segment is surrounded by nice connective tissue. So and it is aerated by its own tertiary bronchi. So during surgical resections, this anatomy of this bronchopulmonary segment is very important. Let's see the blood supply of the lungs. They are supplied by the bronchial arteries. So the right bronchial artery, they arise from the third posterior intercostal. We know the right lung is away from the aorta. So it is supplied by the third posterior intercostal artery. And the two bronchial arteries supply the left lung, which arise directly from the descending thoracic aorta. Venous drainage, the first one, two divisions of the bronchi drains into bronchial veins, and the right bronchial vein drains into azygos because the right side azygos is there. We know, we already saw its relation with the root of the lung. And the left bronchial vein drain into hemiazygos, which is the opposite partner of azygos is hemiazygos. And lymphatic drainage, it has got superficial and deep lymphatics, both drain into bronchopulmonary lymph nodes. Nerve supply, parasympathetic by vagus and sympathetic by T2 to T5. Sympathetic ganglion derived from T2 to T5 segments. So moving on to the applied aspect of bronchopulmonary segment. So anatomically the most important thing is what is the most dependent area in which position. So dependent bronchopulmonary segment in standing position is, you can remember as SPB as an abbreviation, standing position, that is posterior basal. Posterior basal segment of right lung is the most dependent part in standing position. In dependent bronchopulmonary segment in supine position, you can remember the abbreviation as SAL, that is in supine, S for supine again, A is for apical and L is the lower right lung. So this is the most dependent in supine position. So coming to our questions, a bedridden patient on liquid diet develops aspiration pneumonia. Which of the following bronchopulmonary segments is most likely to be affected? So bedridden patient means in which position the patient would be? He would be in supine position. So supine position, you have to remember the abbreviation as SAL, that is apical right lower lobe. So C is the answer, which is the most dependent in supine position. So aspiration in supine posture most commonly involves the right lower bronchus within the superior apical bronchopulmonary segments of the right lower lobe, and it is found at posterior bronchopulmonary segments of right upper lobe as well. So this is the most dependent part. Let's see the next question. All of the following are the characteristic features of bronchopulmonary segment except. So they are surgically resectable. Of course, it is correct. It is named according to the segmental bronchus supplying it. It is drained by intersegmental branch of pulmonary vein independent. Then it is intrasegmental is given here. It is the largest subdivision of a lobe. So the answer would be what? Yeah, C is the answer. The branches of pulmonary veins, they are not intrasegmental, they are intersegmental. They are in between the segments. They lie in the margins of the bronchopulmonary segments and drain the adjacent segment. So each segment is drained by more than one vein, which vein drain more than one segment. So this is all about the important anatomy of lungs. Thank you.